And it's interesting that I never really spent much time with it until we got into this on Cumulus, and we decided, in essence, we needed to do our own healthcare reform. And it's been a runaway cost in terms of healthcare inflation. It's running at 15+% a year. And those are expense line items that, quite frankly, businesses can't afford.
Is that your biggest line item?
It is the biggest line item.
Health insurance.
Yes. So what we're seeing as we got into this, and I spent quite a bit of time to really understand exactly how it works, and so as a result, it certainly is no mystery to me that we've got a runaway problem in this country, and it really has to be fixed. And this is not one of these things that, oh, it'll go away over time. It'll just as people have said with Social Security time and time again, it's broke, but then it seems to be okay, and it seems to be, don't touch, it's the third rail of politics. Healthcare is really serious, and so it is runaway inflation. It is, and basically what it's doing is, the way everybody should think about this, is it's lowering the standard of living for Americans.
And why do you think this is occurring? Why do you think, what's the key driver to the healthcare costs?
Well, most people are insured in this country. Most people have some form of health insurance, employee or employer-provided health insurance. And so what we're seeing, when you have that cost increasing 15% a year, what companies are doing is, in essence, and most companies split with their employees, as we do. It's roughly a 60-40 split, where the employees pay for about 40% of their health care costs, and the company picks up 60% of the tab. So as it goes up 15% a year, your costs go up 15%. And again, that's, your wages aren't going up 15%, so think of that as a tax against your wages. So that's something that's taken out of your paycheck at the rate of 15% when your paycheck isn't going up that much. That's why we say it's lowering the standard of living. And what we're seeing across American business now is that there are hidden taxes that are also being passed down to the employees. So it's not just your premiums going up by 15% to match medical inflation, but then your co-pays going up. Your deductibles are going up. So these are stealth taxes that are being added to the employee. So again, further eroding the standard of living of employees across the country. And so it's a real problem. And so we've tackled it head on and said we've got to really understand at the root of it, what drives medical inflation here? How does the healthcare system work? What are the various components of it? Understand the providers and the vendors, and see if we could, in essence, take it apart, disassemble the car, if you will, and then reassemble it by trying to find the components that are best in class, and try to understand what can, and then this is a big part of it that we'll talk about today, but what can the employees do? What can people do to take greater responsibility for their own health care? For not only taking care of themselves, as we were joking about at the start here, but also in terms of how they consume the product of health care. And so most people have no idea what they're consuming, and they go in, and that's one of the reasons why we're seeing runaway inflation.